Hey everyone, welcome back to the Npte podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. So I'm excited to be with you today. I know that, those of you who are following this podcast, a little bit of break here for the summer. Part of it was, I mentioned this in the last episode, but I had a hip fracture actually this summer, and it's been, just one of those things that I had to rehab, doing a little physical therapy, trying to get my hip back online. But in any case, things are going good. And I'm excited to be back with you here in the podcast. So as you know, here in the podcast, we go through the FSBPT content outline. So all things considered, critical to understand that these are the questions that will be asked of you on the Npte coming up here every quarter. There's an Npte, and so make sure that you are ready as you are finishing up your final clinicals, finals, heading into test day. I want you to be prepared as possible, and that's my goal here with the podcast. So we do have a practice question here for you. Just before we get to that, quick reminder though, if you haven't yet, please leave a review for us over on Google Play, Apple iTunes, Spotify, wherever it is you're listening to this podcast. It helps so much as we try to spread the word, disseminate, and help people pass the Npte. Here at PT Final Exam, I've been doing this for over a decade now. I figure somewhere north of 20,000 students have gone through the program in one way or another. And we've helped so many people get through the exam. Like just this last July, we just finished our July exam, had a couple people who got through on their 6th attempt. Like, let me tell you, that is a stressful situation. If you're facing the Npte on your 6th attempt, you only get 6 lifetime attempts on the Npte. So definitely worth doing it well. And we're extremely excited for those folks. We had a few people get perfect scores. Like over here at PT Final Exam, the goal is just to get you armed with the right content at the right time so that you can absolutely dominate on test day. So let's go ahead and dive into our practice question here for today. So as we go through this class, as we go through the podcast, as I guess somewhat related to the classes we do, going through the content outline. So today we're doing musculoskeletal again. So as we're going through the FSBPT content outline, try to go through each of these systems. Today is an MSK system question that I felt compelled. I had to ask you this question. Somewhere around 44 to 54 questions on test day. So definitely the largest single system on the exam. So without further ado, let's go ahead and dive into our practice question for today. As per usual, I will read to you the question, give you a moment to respond, and then we will talk about it together. All right, here we go. A patient is receiving gait training from a physical therapist after a surgical repair of a lower extremity fracture. The surgeon has written orders for the patient's weight-bearing status to be partial weight-bearing. When using axillary crutches, which of the following gait patterns will be most likely to be implemented? So we've got a patient receiving gait training after surgical repair of a lower extremity fracture. The surgeon has written orders for the patient's weight-bearing status to be partial weight-bearing. When using axillary crutches, which of the following gait patterns will most likely be implemented? So we've got 2-point, 3-point, modified 3-point, or 4-point. So how's that for your answer options? 2-point, 3-point, modified 3-point, or 4-point for the patient whose weight-bearing status has been ordered to be partial weight-bearing. All right, so the correct answer here, the only way you can really get a good partial weight-bearing is with what's called a modified 3-point gait or modified 3-point crutch gait pattern. And what's happening here is in a 3-point gait pattern, so trying to describe this on the audio podcast, a 3-point gait pattern means that you've lifted up the involved lower extremity. You're not even touching the ground with it. It is non-weight bearing and floating. And so you have 3 points of contact. You've got your sound leg as well as 2 crutch points. So that is your 3-point gait pattern. Now, in order to get a modified 3-point gait pattern, what you've done now is you've placed the involved lower extremity on the ground. It's touching the ground, but is only partially loaded because you're able to bear most of the weight through your hands and axillary crutches. So therefore, the modified gait pattern, modified 3-point gait pattern, what you're able to do then is have a more normalized heel-toe progression. So as the patient progresses the involved lower extremity, they can strike the heel, but it's unloaded or less than 50% weight because you have borne most of the weight through your hands and the axillary crutches. So what I tell patients, and I don't know, you can use this if you wish, but what I tell patients is I tell them just pretend there's a little string tied between, an invisible imaginary string tied between your crutches and your sore leg, so that when you advance your sore leg, you're advancing the crutches as well. You advance them at the same time. And then your sound leg can follow up or swing through before you advance again with your sore leg or your involved leg. So that always helped my patients as we were trying to get them to visualize what they were supposed to do before we did it. I would have them visualize the little imaginary string between the involved extremity and the crutches or whatever assistive device. Typically, you have the involved extremity moving with the assistive device, whether it be a cane or crutches or walker or whatever it is. Yeah, that really helped with walkers too. Like, am I doing this right? Say, all right, yeah, you move the walker and your involved or sore leg first, and then you follow that up with your sound leg. The other gait patterns that are mentioned here in the question, the 2-point gait pattern, this simulates normal gait, but you're bearing at least 50% weight through your leg, so it's not a true partial weight. But what you do is you swing, so just hard to describe in audio format, but you swing your right leg and your left arm, or your left crutch at the same time, and then you swing your left leg and right crutch at the same time. So it's like you have this alternating pattern between your upper and lower extremities, much like a normal gait pattern, that you swing your right leg and your left arm at the same time, left leg and right arm at the same time. And so you do that with crutches, and it simulates the normal gait motion, but you're not able to offload more than 50% because you're only striking one crutch at a time. And then the 4-point gait pattern, it's a very slow version of the 2-point, where you move your left crutch, right leg, right crutch, left leg, left crutch, right leg, right crutch, left leg. And so it's very slow, but it is extremely stable. And in this case, I think you could make an argument you could offload your lower extremity because you do have 2 crutches down at one point, but they're not side by side. You have one that's up ahead of or in front of the other one. It's not an ideal pattern for partial weight bearing. So back to the correct answer again, modified 3-point gait patterns. These are the most beneficial for partial weight bearing because the patient can strike the heel and have a heel-toe progression. Just of note here, partial weight bearing is often misinterpreted by the patient to mean that they can only touch their toe, or a lot of times toe touch weight bearing is just the weight of the leg on the ground. And so what happens is they strike their toe for 6 weeks or 8 weeks, however long they're partial weight bearing. They strike their toe, and at the end of that, when it's time to progress to weight bearing or a more normalized gait pattern, you find that the heel cord or the Achilles tendon structures are tight because you've been in a prolonged plantar flexed position. So this is just follows that same rule that if you kind of move it or lose it, in a sense, that if you are maintaining plantar flexion as a position for 6 weeks, it then gets tightened and won't move out of plantar flexion very well. And so you get that heel cord tightness if you just do toe touch weight bearing without any heel strike or heel toe sequence. And maybe there will be a surgeon or surgery that requires more of a toe touch. And so, I mean, that's okay. You just have to work through that heel cord tightness as you're able to. All right, and then just those of you who are watching the video version of this over on YouTube, you'll see I did put a picture here of the modified 3-point gait. And the goal here, again, with the modified 3-point, I tell people you just have a little string attached between your crutches and your involved leg, and ideally you can strike the heel as you advance the sore leg, and then you follow it up with the sound leg. You can either swing to or swing through in that case, and so that's your modified 3-point gait pattern. Excellent. All right, so as we conclude here, just a quick reminder about our VIP class. So every quarter I run a VIP class. This is the one where I personally take you through just so many practice questions. We do numerous practice questions. Additionally, you get access to our full video library of content. We've got 6 practice exams and an exam simulator. These are all full-length practice exams. You can take them as you wish. You can also break them up into quizzes. I have a lot of people who are interested in doing the quizzes where you do either 5, 10, or 15, or 25 questions. Anyway, all of that is a part of the VIP class, and it's one of those things that it's definitely worth it. If you really need to pass this test and you know that you struggle with accountability, you struggle with answering questions correctly, if you can narrow it down to 50-50 and then always pick the wrong one, this class is the one for you. We talk about exam strategy. We talk about question strategy. We also talk about the actual content, much like what we do here in the podcast. Just we ramp that up times 1,000, where we just do lots and lots and lots of practice questions. And in fact, this quarter, as we're heading into October, trying to give some additional content, additional live sessions, it's going to be awesome. Okay, so with that, we'll bring today to a conclusion. I hope you have a fabulous day. I really appreciate what you do as you're studying and trying to become a fabulous therapist. I'm, like I said, at the top of the show, I'm receiving physical therapy at this moment, and I'm extremely grateful for competent PTs out there, and that's you. You're going to do that. You're going to carry the torch on and be fabulous PTs, and that's the goal here, is to get you through the exam so you can get Yeah, get into practice. And then what's even more fun is getting cash positive. You've been paying for the experience so far, and now it's time to get paid for that. So, all right, we'll bring it to a conclusion. Will Crane fist pumps all around. I'll catch y'all later. Take care of yourselves and talk to you soon. Thanks.